Hello, everyone. Welcome back to the Human Anatomy. Today, we're going to be taking a look at abdominal as well as back structures. So let's go ahead and get started. And really quickly, before we do, take a look at this slide really quick. Go ahead and pause and see that we have these abbreviations that will be associated with certain muscles. Like we'll be talking about these muscles, but it's just good to see these as we go through it because you might see them throughout the slides. So basically, these are a lot of your different abdominal as well as back muscles, and it's just easier to see these. So let's go ahead and get started by first taking a look at how everything is going to be organized. So if you look closely, this is the abdominal wall, and you can see the anterior abdominal wall, the posterior side of the anterior abdominal wall. So basically, if you looked at the back of this is what it looked like from the inside. And then if you look closely, you also have the cross sections of the abdominal wall as well. So looking at all of these, some of them look kind of familiar. Like you probably notice that you have these different chunks along the front. And although not visible on all of us, you can definitely see that this would be your six pack. Like this is your six pack, otherwise known as your rectus abdominis. And then you also have muscles that'll be lateral to it, which are mostly obliques, but also the transversus abdominis. But to form these things, as well as kind of surround and connect these things, we do have some connective tissues that are kind of significant in the anterior abdominal wall. Now, if you look closely, let's go ahead and kind of go through this one by one. So first of all, the skin. The skin and the subcutaneous tissue is going to be basically the anterior side of, or the external portions of the abdominal wall. But then you also have the superficial fascia, which is going to be right within or right under the subcutaneous tissue, basically, which is going to be where you have like some very strong connective tissues, but also like that superficial fatty layer as well. So the thing that kind of gets in the way of the rectus abdominis is found in the subcutaneous and superficial fascia. So looking at this though, you can see that there are some things that we want to look at over here. So hold on. Oops, wrong one. There we go. So looking at this, you can see that there are a few different named structures even within here, not just muscles, but even like white connective tissues as well. So to start off with though, if you look closely in the very middle of like the abdomen, going right down the front, this going down the midline is called the linea alba. So this white line, the linea alba, is going to be right down the middle, which is helping to divide up the left and right sides of the rectus abdominis. Now, if you also look closely though, like on this picture, you can see that there are these lines going across the rectus abdominis. Those are going to be called tendinous intersections. So with the tendinous intersections, that is how you're going to ultimately get those little chunks that form the six-pack muscles. So tendinous intersections going transversely, linea alba going longitudinally or axially. But then if you look at the cross section, there are also these parts that go along the outside of the muscle as well. Now, not fully visible, like if you put this slide, you can see that this is going to be present covering the rectus abdominis. This is called a rectus sheath. And you have a rectus sheath both on the anterior side, not visible on this one, but on the posterior side, internally as well. So those respectively on the front or on the anterior side will be the anterior rectus sheath. And then you also have the posterior rectus sheath. So anterior rectus sheath and posterior rectus sheath, those kind of surround the rectus abdominis. And you can see that the anterior one's pretty complete going down generally to the inguinal ligament, basically. But then you also have the posterior rectus sheath, which technically doesn't go all the way down sometimes. You have this region called the arcuate line, which is going to be right near maybe the bottom fourth of the structure. But something else that's visible here that we don't always think about too much is that this is surrounding the abdomen. And there's going to be a layer that helps to protect and surround the abdomen right on the inside of this called peritoneum. So peritoneum is going to be the layers that surround the digestive organs, just like how you had pericardium, just like how you had the pleural linings. Like this is going to be what surrounds the abdominal structures. And in this case, along the wall of the abdomen, this is called parietal peritoneum. All right, so now let's go ahead and take a look at the posterior abdominal wall, which also has some stuff, which will typically have skin, hopefully, but then also the subcutaneous tissue, the superficial fascia, but then you also have just a couple of specific structures to look for as well. So you'll have the thoracodorsal fascia, and the thoracodorsal fascia is going to have like a few different layers to it. So you'll have the anterior layer, which is technically like the deepest one, because remember, we're on the posterior side of the abdominal wall. The anterior side of this is going to be right along like the vertebrae, basically. The middle layer is, as its name suggests, in the middle, but then the posterior one is the most superficial portion, which is what you see from the outside. So just to be clear, thoracodorsal fascia, like sometimes it's interchangeable with thoracolumbar fascia. So generally, they're almost the same, but I mean, thoracolumbar does also have like the connotation of being lower down. So, but thoracolumbar, I guess, does cover its bases. Now, posterior layer, like I was saying, this is going to be kind of like the most superficial. This is the portion that you mostly see kind of like along the outside. So the posterior layer will be along the outside, like the most superficial. But then you also have the middle layer, which is going to be connecting to the transverse processes. So this one is kind of like on the inside to some extent. Like this one doesn't like represent it too well, but it is going to be right along the inside. Right. No, this doesn't show too well either. But kind of along like the inside of the abdomen here. So this is called the transversus abdominis. That's where you'll find the middle layer. But then the anterior layer will be right along kind of the front of the vertebrae. And that is going to be where you have the anterior longitudinal ligament. So it's kind of continuous with that, right along the anterior longitudinal ligament, deep within the abdomen. And then like the anterior side, you do have the parietal peritoneum, which is going to be deep inside of here as well, surrounding the abdominal organs. Now, you do have like an endo-abdominal fascia as well, which I don't think is shown very well here. So, I mean, at the very least, make sure that you can find thoracodorsal fascia and all of the things that it's attached to. Now, let's go ahead and start by taking a look at our abdominal muscles on the anterior side, where you have the well-known rectus abdominis, but then also like a few layers which are lateral to those muscles as well. So the rectus abdominis. So rectus abdominis, rectus meaning straight, abdominis meaning abdomen, are the muscles going straight up and down the front of the abdomen. And as I've said probably multiple times at this point, this is what's helping to make the six-pack. So you can see that the rectus abdominis is going to go all the way up to the xiphoid process, but then also, kind of oddly, over some of the ribs as well. So it connects to the costal cartilages of ribs 5 through 7, which is going to be like the lowest costal cartilages, because those are the ones that are the actual vertebrosternal or true ribs. So vertebrochondral ribs that will be like over here. Vertebrosternal ribs will be more medial with the rectus abdominis attached, and then it goes generally all the way down to the pubic crest and pubic symphysis. So this is going towards like the middle of the pelvis, And then also a little bit of it connects to like the inguinal ligament as well. Now, this muscle is on the front of the pelvis, or sorry, front of the abdomen, and when this muscle contracts, it pulls your trunk downward, as in like it flexes the vertebral column. So it flexes the vertebral column, but if fixed, your rectus abdominis can also pull on the pelvis alternatively. So when it pulls on the front of the pelvis from the pubic symphysis, it is actually going to cause some posterior tilt. So it helps with tilting it tilts the pelvis posteriorly or towards the back. And this is going to be innervated by the spinal nerves T7 to T12. Now, looking lateral to the rectus abdominis, like looking at this one first. Like, if you look closely, there are actually layers that we're looking at here. And the most superficial layer, hopefully, somewhat clearly, is going to be the external oblique. So the external abdominal oblique is going to be lateral to the rectus abdominis. But when we look at these muscles, you want to pay attention to a couple of things. Like number one, like what layer is it? But number two, what direction do the muscle fibers go? So if you look at this picture, you can see that you have the external oblique directly lateral to the rectus abdominis. And that is where you're going to be able to see that is connected to the rectus abdominis, or rather to the aponeurosis connecting to the external to the external oblique. And then its muscle fibers are going to extend up and laterally. So these are kind of like a diagonal, and the way that I like to remember external oblique is that it helps to eventually, if it were to continue, form like a V shape. So external oblique will be like kind of like this, going down towards the midline, generally forming like a V-like shape. But if you look at the external oblique, you can see what it's kind of like connecting to. So it's kind of connecting to the serratus anterior. It is going to be connecting to the ribs more specifically along the serratus anterior. And then it's also going to go like towards the back along the dorsal sides or lateral sides of the ribs. So this is going to be what's kind of like allowing it to surround the lateral or encapsulate the abdomen to some extent, but it will be connecting to the ribs generally, as well as like the serratus anterior to some extent as well. Now, if you follow them, you'll be able to see that they go down to either the aponeurosis of the external oblique that goes to the anterior rectus sheath, or it will go down to the aponeurosis of the external oblique as well as the inguinal ligament. So this is all going to be going down, and if you look closely, it kind of starts at the anterior superior iliac spine and then goes down to the pubic crest. So this right here, this is going to be where you have the boundary of the aponeurosis of the external abdominal oblique. Now, when you contract this muscle, like looking at these muscle fibers, well, it'll be able to do a few things. So first, unilaterally. So unilaterally, this can either help with lateral flexion of the abdomen, but also rotation of the abdomen as well. Like notice the diagonal line, like this is going to be able to help with twisting the abdomen because it pulls your thorax down and medially, down and inward. So it's not just down in the lateral or sagittal planes, but this is going to be helping with twisting the abdomen. But if bilaterally contracted, it can also help with flexion of the vertebral column, just like the rectus abdominis. So your sit-ups, your crunches, like you use the external oblique to some extent, but mostly rectus abdominis. Now, something that's kind of unique to these muscles is that basically right underneath that, this is where you're going to have a lot of abdominal organs. So when you contract these muscles, you also do compress the abdominal organs as well, which can affect digestion, but also respiration as well. So this is going to be external abdominal obliques, which is innervated by T7 to T12. Now the internal obliques, I want you to look closely because when you look at this just very briefly or without detail, I mean, this looks like it could be any of the abdominal muscles. But if you go between these two slides, you'll notice that there's a pretty big difference. The external oblique has the muscle fibers going downward and inwards to form like that V shape. The internal oblique actually has a few different orientation of its fibers, mostly upwards, diagonally upwards, and then across. So in the case of the internal abdominal oblique, you actually have upper, lower, and then lateral fibers. So upper and lower are basically what you'd expect, like upper and lower, but then you also have lateral fibers that are going to be more along like the sides. So depending on which fibers you're talking about, it'll go in different directions. But the main thing for the internal oblique is that it does not go down and inward. Like remember, well, looking at these muscle fibers, are they going down to form a V? They are not. Internal oblique has muscle fibers that go across or upwards. So it's going to be attached to quite a few things, but mostly, like the ilium, it'll be attached to the iliac crest, it'll be attached to the anterior superior iliac spine, and then it will also be attached on the back along the lateral fibers at the thoracolumbar fascia. So thoracolumbar or thoracodorsal fascia, you'll have the internal obliques attached to the back of the abdomen over there. But following it, you'll also see that it goes to the aponeurosis of the internal oblique, which will then connect to, in this case, both the anterior and posterior rectus sheath, and then the linea alba. So these muscle fibers, when they contract, like they will also do kind of like some stuff as well, which will include very similar things like lateral flexion, but in this case, ipsilateral rotation. So just to be clear, for the external oblique, that was contralateral rotation, where when this contracts, the right side, you're actually twisting your body to the left. But for the internal oblique, this is going to be helping with ipsilateral rotation, lateral flexion, and then just like before, flexion of the vertebral column, and then also compression of the organs as well. Now, in this case, we have a couple of nerves which might sound familiar. So you have L1, which is going to have contributions from the iliohypogastric and ilioinguinal, and then also the spinal nerves T7 to T or L1. So if you remember the lumbar plexus, like that's where you have the iliohypogastric and the ilioinguinal nerves. Now, lastly, for our anterior abdominal wall, we have the transversus abdominis. The transversus abdominis, which, if you look at its name, transversus means transverse, it goes across abdomen, across the abdomen. So this one, just to be clear, is actually the deepest layer. So if you look at the external oblique, that was cut. Internal oblique, that was cut. But now you can see the transversus abdominis, which is the deepest layer. So in fact, if you go to like the view looking at the inside of the abdomen, this right here is the transverse or transversus abdominis, on the inside of the abdomen. Now the transversus abdominis, this one goes across, it connects along the inside. It goes from like the ribs over to, well, the anterior side at the transverse or the aperos of the transverse abdominis. But along the pelvis, it does also connect to like the pubic crest, the pectineal line, and then also, well, the linea alba. Now, this muscle is a little bit different from your other muscles. It does not really have any vertical fibers. This one is largely is going to be used for flattening and compressing the abdomen. So, although the other ones do that to some extent, this internal layer is largely for that function. So, this is going to be helping with compressing the abdomen, but it then can also have an effect on respiration by depressing a little bit of that sternal angle as well. So as it attaches down here, it could pull on that and compress it to help with expiration. And like before, this deep muscle is going to be innervated by parts of the lumbar plexus, L1 from iliohypogastric and ilioinguinal nerves, and then spinal nerves T7 to L1. Now, these muscles we've talked about before, so I don't think I need to go over them too much, but if you look closely, we have muscles that we talked about that mostly affect the lower extremity, but we do have like the diaphragm and the quadratus lumborum, which we may not have talked about quite as much. So to start off with, quadratus lumborum. So looking at this deep, or this picture of the deep abdomen, let's just kind of orient ourselves so where you can see the lumbar vertebra, the ilium, which has iliacus on top of it, and then that means that this is the iliac crest. And that's basically what we need to look for, because if you look closely, this right here is the quadratus lumborum. So quadratus lumborum is going to be a kind of like blocky four-sided muscle, but in the lower or the lower back, and starting at the iliac crest, it goes upwards towards your lumbar vertebrae. So it connects along the transverse processes of the lumbar vertebrae, and in this case, attached or along the back of the abdomen. This will help with extending the lower back, but then unilaterally it helps with lateral flexion and then pulling on the last rib as well. So this is the quadratus lumborum. It is going to be connecting between iliac crest, last rib, and then the lumbar vertebrae L1 to L4. Now, something that you may have kind of like been able to use or reference to is that you can see some muscles that you hopefully find familiar. So starting off with like right next to quadratus lumborum, you can see that there's a very recognizable muscle, the psoas major. So the psoas major is going to be right next to quadratus lumborum, but notice some main differences between these. Like it is going to be connected to the lumbar vertebrae to some extent, but then it is going to not stop at iliac crest. It is going to go all the way down and through, all the way down to like the femur at the lesser trochanter. So this muscle we've talked about, I think we don't need to go over it too much again, but this is going to be largely like a hip flexor. But it does have other functions, which we've talked about previously. Now the psoas minor, same thing, but the psoas minor you can see is a smaller muscle along the psoas major, and that is going to be, well, basically as its name suggests, the small little one, but going past iliac crest from the lumbar vertebrae again. Now, iliacus is one that I've actually referenced to right now, but just to reiterate, here is the ilium with the iliac fossa and the iliac crest right above the like superior edge of it. So the iliac fossa and crest is going to be basically the border of iliacus, which travels downward with psoas major to the back of the femur over here, where together they help to make that iliopsoas, which is helping once again to like flex the hip. Okay, so those were the internal as well as anterior abdominal muscles. But now we have some trunk muscles or back muscles to talk about as well. So we actually talked about a lot of these already. So in your back, you have extrinsic muscles, which are the ones that we know about, such as trapezius, rhomboids, as well as levator scapulae, serratus posterior, superior, and inferior. But the ones that we're going to be focusing on today are called intrinsic muscles. So if you remove all these muscles, and even serratus posterior, superior, and inferior are kind of in the way, this is where we're going to see the deep back muscles. These are not necessarily affecting the ribs or the scapula. These are going to be affecting the vertebrae more than anything, or the head. So if you look closely, the intrinsic muscles are, well, actually not visible, but the intrinsic muscles are going to be kind of layered into deep, intermediate, and superficial muscles. But at the very least, you can see a little bit of superficial and intermediate, where you can see that there are back muscles that go to the head over here, and then there are back muscles that are like very longitudinal going along the back over here. So those would be the superficial and deep layers, or superficial and intermediate layers, where we can see some of your intrinsic back muscles. So to start off with, for the superficial muscles, you can see that you have something called the Splenius cervicis, and then you'll also have the Splenius capitis as well. Now, before we get started, what you'll see is that a lot of those muscles have those types of naming conventions. Like when you think, or when you hear the second word, which will be either like cervicis, capitis, thoracis, and so on, like that's basically indicating kind of like what region of that muscle it is. And that will also play a role in what they're attached to, as well as what they do. So to start off with, you have this muscle right along like the back of the neck, which is called the Splenius cervicis, which has another part to it called the Splenius capitis. Now, Splenius cervicis is the lower one, where you can see it attached to like some of the thoracic vertebrae, but it's Splenius cervicis, which is like cervical, like in cervical vertebrae. So it is going to be attached over along the sides of the transverse processes of C1 to C2, and sometimes 3. Now, being on the back of the neck, this is going to affect the neck. So this will help with extending the neck, laterally flexing the neck, and then when this muscle contracts, it can also rotate the head and neck, which in this case is going to be an ipsilateral rotation. So when this muscle back here contracts, it is going to be your right muscle, and it pulls your head to the right as well. So ipsilateral rotation, and it is going to be then innervated by the dorsal rami and spinal nerves of the cervical and upper thoracic regions. So the dorsal rami, keep in mind, like those nerves are coming out very close to the vertebral column, and then they just go very superficially, or not superficially, they go kind of through the deep back to these muscles now. Now, Splenius capitis, capitis is like referring to the head, and in this case, it still kind of like comes from the vertebrae. So coming from the vertebrae, but then it is also going to go over here to the side of the head now at the occipital bone, but also the mastoid process. So this is going to be not connected to the vertebrae anymore, the cervical vertebrae, which was the cervicis. This one's going to be attached up to the back of the head at the occipital bone, and then also the temporal bone. This muscle is similar in that it's going to help with extension, lateral flexion, but then also rotation of the head, but specifically by connecting to the actual head itself in this case. So the other one was kind of like pulling on the, or turning the head by pulling on the vertebrae. This one can pull on the head itself, which is going to help with its rotation as well. So similar nerves, dorsal rami, spinal nerves of the cervical regions in this case, not upper thoracic though. So Splenius cervicis was the ones attached to the neck. Splenius capitis were the ones that attached to the head. And then that leads us to our next group of muscles in the intermediate layer, which is the erector spinae group. So, well, I think actually, no, these are superficial still. No, you're right. So this is the intermediate layer. So the intermediate layer is going to be the erector spinae group, which has three main muscles: the iliocostalis, the longissimus, and then also the spinalis. And as you can see, each of them do have their specific parts, which is going to be slightly different in what they do, but quite different in what they're attached to. So in this case, you basically use the name of the muscle and then add in like the kind of modifier in lumborum, thoracis, and cervicis in the case of iliocostalis. So you can call it iliocostalis lumborum if it's in the lower back, iliocostalis thoracis if it's in the back of the thorax, or iliocostalis cervicis if it's in the neck region. So, as you can see, there's a lot of stuff that goes along with this, especially since there's three parts to each. Now, there is a lot of detail to this, but I will just kind of like give you a heads up regarding what I'm going to be requiring, which is largely going to be their differences in their actions, but then also their differences in like their bony landmarks. Like numbers of ribs and so on are not part of the detail that I'm quite as much interested in, but at the very least, if it's connected to different landmarks, that would be good to know. If it's like divided at a certain rib, that would be good to know. If it's like along a different part of the vertebra or something, that would be good to know. And then also their actions and how to differentiate them are kind of good to know as well. But knowing exactly the ribs, exactly like what's included in every single thing is not exactly what I'm also looking for. So, to start off with, let's look at iliocostalis. Iliocostalis, when you think of that name or when you hear that name and break it down to ilio and then costalis, ilio is referring to the ilium, so you can see a muscle going all the way down to the ilium, and then costalis is going to be referring to the ribs. So iliocostalis is actually the lateral most out of these erector spinae. You can see that right here, and then also right here. Now, ilio, meaning ilium again, this is going to be connected down here at the ilium, but also to some extent like along like the iliac crest as well. But then it is going to be connected at the lumbosacral fascia down here before it extends upwards to go to the costals. So as you see, like along like the different regions, so the iliolumborum goes to ribs 6 to 7 along the inferior angles. Along the upper borders of the angles, you have the ribs as well, and then you have even more ribs for like the cervicis too. So, oh sorry, no, for cervicis, that's the origin. Okay, sorry, I've been looking at the origins. So the origins are going to be like the ribs, where you can then see them going. All right, I got a little bit mixed up. So here you can see the ilium being like the origin of the lumboral region, and then you can see it going up to the ribs along their like insertions. So yeah, I think I was looking at the right thing, but insertions over here for lumborum, this is going to be the ribs over here. The thoracic region is going to be the ribs like basically right above it. And then for the cervical region, like this one is actually going to go to like the cervix or the cervical vertebrae. So these are actually going to start at the ribs now and then go up to the cervical vertebrae. So there is a little bit of a difference going along the iliocostalis. It starts down here. It goes to the ribs for the lumborum region. It goes to the ribs for the thoracic region. But then for the cervical region, it starts at the ribs and then it goes up to the neck at the cervical vertebrae. Now, looking at their actions, I mean, these two will be very similar because they're connecting to similar things as well as they are along the same kind of plane. These will help with extension and lateral flexion of the vertebral column. But then when you get up to the cervical region, this is where you can actually affect like a little bit of the neck. So this will help with extension of the vertebral column again, as well as the lower cervical region as well. But largely, when you look at their innervations, they're innervated by the dorsal rami and spinal nerves along their like respective regions. Lumborum, lower thoracic, and upper lumbar. Thoracic is going to be thoracic, and then cervical or cervicis is going to be mid-cervical to mid-thoracic segments. Now the longissimus is the one right here in the middle. So you can see the longissimus, and the longissimus, as its name suggests, is quite long. And in this case, it doesn't have a lumbar region, so it starts at the thoracis, but instead it goes all the way up to cervicis and then to capitis as well. So the iliocostalis did not have a capitis region. It went only to cervicis, but longissimus and spinalis will go up to capitis. So for the longissimus, you can see that it's in the middle. So here's iliocostalis. This one is longissimus. And in this case, you'll be able to see that it kind of goes up along like the middle regions and then not necessarily like go along like the closest regions of the vertebrae, but to a lot of the transverse processes of the vertebrae. So the vertebrae are going to be right here in the middle, and then the longissimus is going to be connected to a lot of its transverse processes. So if you look at like this muscle, it's going to be connecting kind of slightly lateral along the vertebral column, basically. So for the thoracic region, it goes up and connects to a little bit of the ribs, but also the transverse processes of the thoracic vertebrae. Cervicis is going to go up and then go to the transverse processes of the cervical vertebrae. And then capitis, remember, capitis is a little bit different. Capitis is going to be going to the head. So in this case, it's actually going to be connecting very close to like a lot of other muscles at the mastoid process. So the mastoid process is going to be like kind of on the lower back side of the head, and that's where you'll have the capitis region of longissimus attached to. So once again, these will be very similar. They help to extend the back, laterally flex the back, just depending on their regions to some extent, but also it does pull on the ribs downward as well. But for the capitis region attached to the mastoid process, this is going to be helping with some amount of, well, extension, lateral flexion still, as well as rotation of it too. Now the spinalis is the last of your erector spinae group, at least, where you'll be able to see it like being the medial most muscle right along the vertebrae. So for spinalis, as its name kind of suggests, it is going to be along the spinous processes. So from spinous process to spinous process, from spinous process to spinous process, and then also from like the regions of the semispinalis, which is also along spinous processes, over to the neutral lines of the occipital bone, all the way in the back over here. So the spinalis is going to be very, very closely associated, at least in the head region, with the semispinalis. But down here, it's generally a little bit more distinguishable going a little bit further down. So spinalis is going to have the thoracis, cervicis, and then capitis regions, very similar to the semispinalis. But in this case, spinalis going from like spinous process to spinous process, these are very like medial along the vertebrae. So in this case, once again, these two, thoracis and cervicis, very similar, extension of vertebral column, and then extension in the thoracic versus cervical, respectively. And then the capitis region is going to be where you can extend the neck as well as rotate the head as well. So spinalis, that is going to be helping to extend basically all of the vertebral column, but then also it's going to help with rotation of the head to some extent, attaching to the neutral lines of the occipital bone. Now, lastly, we get to our deep muscles where we have some pretty different muscles. Like this is going to be coming like in a lot of different chunks in this case. So let's go ahead and start by taking a look at the semispinalis. So I actually just talked about this a bit, which basically is going to be very, very closely associated to the spinalis. But in this case, up here in the head, it is a little bit more superficial. So if you do see the back of the head and neck over here, so kind of like this, you can see the Splenius capitis that's sticking out, but then the semispinalis capitis is this region all the way up here. So semispinalis capitis is this region up here, but then it does technically go down as well. So this is going to be very close to spinalis as well, but semispinalis capitis, at the very least, you can see it superficially along the back of the head and neck. So semispinalis, I mean, it is going to be connected to some spinous processes, but it's also going to be connected to the transverse processes as well. So transverse process to spinous process, transverse process to spinous process, and then transverse process to the back of the head along the inferior and superior neutral lines of the occipital bone. So the spinalis was the ones going from like spine to spine. Semispinalis will be going from transverse process to spine instead. So once again, though, the actions help with some extent, like being very similar, extending the vertebral column and then rotating the vertebral column a little bit. Same thing down here, except for its respective regions. And then for the capitis, once again, not just vertebral column, but it can also help with extending and then rotating the head too. Now, while you had semispinalis kind of higher up, you have something somewhat similar lower down called multifidus. So multifidus is going to be a little bit of an interesting muscle because it will be going from transverse process to spinous process, very similar to semispinalis, but it is actually going to kind of skip a couple vertebrae at a time. So these muscles are a little bit kind of longer looking, which can skip potentially 2 to 4 vertebrae, depending on where you're at in the multifidus. So while you start like at this transverse process of a vertebra, it is actually then going to go up. Like in this case, it looks like 1, 2, 3, 4 vertebrae to go all the way up. But sometimes you'll just see it going like 1 or like 2 or 3, which is somewhat more noticeable. Now, the main thing that's a little bit different about its regions is that depending on where you are, it'll attach to like slightly different things along the vertebrae. So for the lumbar vertebrae, there's actually a process called the mammillary process, which is kind of like part of the transverse process. That is going to be where the multifidus attaches to down here. And then as you go up along the thoracic vertebrae, it connects to its very typical transverse processes. And then for the cervical vertebrae, it attaches to the articular process of like the cervical vertebrae up here. So this muscle, this is going to help with extending the vertebral column as well as rotating the vertebral column as well. Now, one of my least favorite words to say, but it's kind of, I don't know. All right, rotatores. So for some reason, it's always kind of weird, but rotatores is going to be very similar to multifidus and semispinalis, but these are actually going to be deeper than all of the rest. So you can see multifidus here, but without, or if multifidus is here, you cannot see rotatores. So rotatores you can see right here, but slightly different. It does go from transverse to spinous process, but in this case, just to the vertebra above it. So these will be relatively short and a little bit more slanted because they're more angled and shorter muscles. So transverse process to the next spinous process, transverse process to the next spinous process. And the rotatores go up along the vertebrae, which means that it will help with, as usual, extending the vertebral column and rotating it as well. Now, the last couple muscles we have here are luckily pretty intuitively named in contrast to like multifidus. In this case, you just have like interspine and intertransverse. So interspinalis, that's going to be between spinous process to spinous process, but like directly from spinous process to spinous process. So this is kind of like this continuous line going up the spinous processes where you can see that you have these small muscles in between from any given spinous process to the next. So you have 6 that'll be in the cervical region, 11 that'll be in the thoracic, and then 4 will be in the lumbar. And these all help with extending the vertebral column. Now, lastly, we have the intertransversari, which is going to be between transverse process and transverse process. So you can see this in the same type of like manner where you go from transverse process to transverse process and going up along the vertebrae, along the transverse processes. So in this case, for the most part, this helps with lateral flexion of the vertebral column being on the sides of the vertebrae. So I think that's it for this lecture. This will be the last lecture for your 6th exam. So good luck with your studying. Let me know if you have any questions, and I'll see you all next time.